As part of informing Americans about the swine flu threat, Dr. Sensor's CDC also helped create the advertising to get the public to take the shot.
Let me read to you from one of your own agency's memos planning the campaign to urge Americans to take the shot. The swine flu vaccine has been taken by many important persons, he wrote. Example, President Ford, Henry Kissinger, Elton John, Muhammad Ali, Mary Tyler Moore, Rudolph Nureyev, Walter Cronkite, Ralph Nader, Edward Kennedy, etc., etc. Mary, did you take a swine flu shot?
No, I did not.
Did you give them permission to use your name saying that you had or were going to?
Absolutely not. Never did.
Dr. David Sensor, then head of the CDC, the Center for Disease Control in Atlanta, is now in private industry. He devised the swine flu program, and he pushed it.
Where did this so-called deadly variety of flu, where did it first hit back in 1976? It began right here at Fort Dix in New Jersey in January of that year when a number of recruits began to complain of respiratory ailments, something like the common cold. An Army doctor here sent samples of their throat cultures to the New Jersey Public Health Lab to find out just what kind of bug was going around here. One of those samples was from a Private David Lewis who had left his sickbed to go on a forced march. Private Lewis had collapsed on that march, and his sergeant had revived him by mouth-to-mouth resuscitation. But the sergeant showed no signs of illness. A few days later, Private Lewis died. The New Jersey lab identified most of those soldiers' throat cultures as the normal kind of flu virus going around that year, but they could not make out what kind of virus was in the culture from the dead soldier and from 4 others who were sick. So they sent those cultures to the Federal Center for Disease Control in Atlanta, Georgia, for further study. A few days later, they got the verdict: swine flu.
But that much publicized outbreak of swine flu at Fort Dix involved only Private Lewis, who died, and those 4 other soldiers who recovered completely without the swine flu shot.
If I had known at that time that the boy had been in a sick bed, got up, went out on a forced march, and then collapsed and died, I would never have taken the shot.
You began to give flu shots to the American people in October of '76.
October 1st.
By that time, how many cases of swine flu around the world had been reported?
There had been several reported, but none confirmed. There had been cases in Australia that were reported by the press, by the news media. There were cases in...
None confirmed. Did you ever uncover any other outbreaks of swine flu anywhere in the world?
No.
Now, nearly everyone was to receive the shot in a public health facility where a doctor might not be present. Therefore, it was up to the CDC to come up with some kind of official consent form, giving the public all the information it needed about the swine flu shot. This form stated that the swine flu vaccine had been tested. What it didn't say was that after those tests were completed, the scientists developed another vaccine. And that was the one given to most of the 46 million who took the shot. That vaccine was called X53A.
Was X53A ever field tested?
I can't say. I would have to...
It wasn't. Did anyone ever come to you and say, you know something, fellas? There's the possibility of neurological damage if you get into a mass immunization program?
No.
No one ever did?
No.
Do you know Michael Hatwick?
Yes. Mm-hmm.
Dr. Michael Hatwick directed the surveillance team for the swine flu program at the CDC. His job was to find out what possible complications could arise from taking the shot and to report his findings to those in charge.
Did you know ahead of time, Dr. Hatwick, that there had been case reports of neurological disorders, neurological illness, apparently associated with the injection of influenza vaccine?
Absolutely.
You did?
Yes.
How'd you know that?
By review of the literature.
So you told your superiors, the men in charge of the swine flu immunization program, about the possibility of neurological disorders?
Absolutely.
What would you say if I told you that your superiors say that you never told them about the possibility of neurological complications?
That's nonsense. I can't believe that they would say that they did not know that there were neurological illnesses associated with influenza vaccination. That simply is not true. We did know that.
I've said that Dr. Hatwick had never told me of his feelings on this subject.
Then he's lying.
I guess you would have to make that assumption.
The vaccine is experimental and will be given to 6-month to 17-year-old children, and compensation will be provided.
If you call Children's Mercy and end up on hold, that H1N1 recording might be what you hear. Part of an effort to recruit families for the testing of an H1N1 vaccine on children. The compensation, we are told, will be $50 for each of 5 visits, plus $15 for each of 5 phone calls, for a total of $325. But at the health department, they'll tell you, we all benefit.
We're actually fortunate that Children's Mercy, an important partner here in the area, is part of the research trials for this vaccine.
No one yet knows how much of the vaccine will be available and when exactly it will be available.
And the additional challenge with the H1N1 is it's not just one shot, it's that shot plus a booster. So
Dr. Archer adds that he wouldn't hesitate to sign up a loved one for such a vaccine study.
if I had kids of that age, I probably would be getting on the list to get the shot.
I don't care! You people don't care about the trillions! Get off my phone! Get off my phone!